Do COVID vaccines cause infertility? The short answer is no. But where did this myth come from, and how has it become so popular around the internet? My name is Maxine Danso. I am a senior researcher with Dubawa Ghana, which is a fact-checking organization. Let's debunk this myth. According to an open access government publication, this myth on infertility and COVID vaccine caused Google's search on the subject to increase by 34,900% after this misinformation went viral. COVID-19 vaccines causing infertility? This myth has been disproved by health experts and scientists all the many times it has come up. It has gone through several phases, twists and turns. Now, let's go to the very first time this assumption came up. On the 1st of December 2020, two doctors, Dr. Wolfgang Wodak and Dr. Michael Yeadon, issued a petition that would withhold the emergency use of the BioNTech Pfizer vaccine for COVID-19. At that time, these two epidemiologists were calling for more research based on observations made that the vaccine may make women's bodies reject or attack protein which is involved in the growth and attachment of the placenta during pregnancy, and this could in turn make women infertile. This was assumed because the protein in the placenta called syncytin-1 happens to share a small piece of genetic code with the spike protein of the coronavirus. Shortly after this petition was issued, some anti-vaccine activists started campaigning that the vaccine could impact fertility in women. But remember, the two doctors were only sounding an alarm that this assumption should be investigated. After this misinformation went viral, research conducted showed that it affected public perception and decision-making on the vaccines among pregnant patients and those who intended to get pregnant. Yet, many doctors and scientists attest that this was a theoretical risk that was completely disproving in the clinical trials and continues to be disproving in real time as more women of childbearing age become fully vaccinated and are conceiving and giving birth. So another time that this assumption came up was earlier this year when vaccines were being administered. Some women started noticing some irregularities in their menstrual cycle after being vaccinated. According to research headed by Dr. Catherine Lancy, who is the head of anthropology at the University of Illinois in the USA, it was found that after vaccination, some women experienced a heavy flow, and for some older ones, they experienced breakthrough bleeding. Scientists agreed that this was possible since immune cells play an important role in menstruation, and so it is in fact possible that the vaccine could temporarily alter the process. But unfortunately, establishing a link between this and infertility has proven difficult, mainly because trials for the new vaccines never asked women about their periods. Scientists say that there is so much natural variation in women's cycle month to month that a controlled clinical trial would be needed to try and establish whether it was really happening.
The vaccine should not affect fertility, and theoretically it does not. We have had multiple patients get the vaccine since December and January, and we have numerous patients who are now pregnant after receiving the vaccine. If you are a patient who is considering pregnancy in the future and you're weighing your risk, I would get the vaccine. It will not affect your fertility. If I was a patient and someone who has not had a child yet, I did get the vaccine, and I am not concerned about that affecting my fertility in the future.
If for anything at all, health experts recommend that pregnant women need the vaccine to avoid complications during pregnancy if they are infected with COVID-19. Men are also urged to get vaccinated, considering that COVID-19 could affect their reproductive health, because COVID-19 has been proven that it could have long-term effects on men's reproductive health, such as erectile dysfunction. In fact, numerous reports have quoted leading doctors like Dr. Laura Morris, who says pregnant women get sicker when they get COVID compared to other people their age, and pregnant people with COVID are more likely to experience preterm delivery. Dr. Albert Shu also recommends the COVID vaccine for men concerned about their fertility because of the possible effects that COVID-19 disease could have on their reproductive system. Catherine Paulers, who is an infectious disease physician at Penn State Health Milton S. Hershey Medical Center, explained that the COVID-19 vaccines work by prompting the body to generate copies of the coronavirus's spike protein. These copies teach the body's immune system to recognize the real spike protein so that it can fight the virus in the event of an infection. The World Health Organization's chief scientist, Dr. Soumya Swaminathan, also had this to say concerning COVID-19 vaccines and fertility.
Yes, it's a common myth, and I should start by saying that there is absolutely no scientific evidence or truth behind this concern that vaccines somehow interfere with fertility, either in men or in women. Because what vaccines do is they stimulate an immune response against that particular protein or antigen of that virus or bacteria. So in this case, the COVID vaccines stimulate both antibody response and a cell-mediated immune response against the spike protein of the SARS-CoV-2 virus. So there is no way in which they could interfere with the functioning of the reproductive organs in either men or women. So I think people can rest assured that these vaccines in no way interfere with fertility.
So while studies are ongoing, there is no data and there is no credible scientific evidence or theory as yet for how COVID-19 vaccines could cause male or female infertility. So the next time you see this myth flying around the internet, be sure to check what the experts are saying.